Hello everyone, myself Dr. Abhinay Huche. I am a consultant neurophysician practicing at SLG Hospitals, Hyderabad. So today the topic that I have chosen for discussion is vertigo. So first let us understand, for the common public, let's understand what vertigo is. So vertigo is not a disease per se, it's just a symptom, it's a manifestation. Vertigo can be present in many disease entities. So vertigo is not a disease, but per se it's a symptom of some disease in the body. Many people are not clear about what vertigo actually means, so they keep confusing between different terminologies and they keep seeking consultations with the complaint that they have vertigo. So what does vertigo actually mean? Vertigo actually means you get an illusion that you or the surroundings around you are revolving or rotating or oscillating around you. So that is actually vertigo, which means that an illusory sensation that either you are spinning or the surroundings around you are spinning. So that is vertigo. So I see many consultations where patients complain of vertigo, but they don't understand the meaning of what vertigo actually means. So what is the role of the doctor here? So this is a symptom wherein patients can visit either general physicians, internal medicine consultants, they can visit ENT doctors, and they can many times visit neurologists as well. What is the role of the doctor here? The role of the doctor here is to first understand the hidden meaning of the patient's symptoms. So history forms a very important part when the patient complains of vertigo. First, the doctor has to dissect the symptom, whether it is actually true vertigo, or it is vertiginous sensation, or it is some kind of vague dizziness. So this is a gray area between physicians, neurologists and ENT doctors. So that is why first 5-10 minutes we just spend taking history and asking the patient many questions. So I usually have a long questionnaire. What do you mean by the term vertigo? What are you experiencing? Is there actual spinning, or are you experiencing spinning in your head, or is there a problem in walking? Or is there a blackout in front of your eyes? Are the symptoms positional, meaning if you are getting up from the lying down position, if you are bending down, are your symptoms positional? Is there any difficulty walking? And what are the associated symptoms with vertigo? Because many people have a nauseating sensation, some people may have a headache, some people may have vomiting, some people may have balancing issues. So all these questions need to be asked. So the first aim of the doctor is to dissect what this symptom is and where it could arise from. As I told you, there are many terms which are confused, like dizziness, giddiness, vertigo, all sound the same. So I need to dissect first what is your exact symptom. So I need to differentiate whether it is true vertigo or it is some kind of balancing issue. So where does this vertigo arise from? In general, vertigo arises from the balancing system. So you all must be aware that our body has a complex balancing system, and the balancing system consists of the brain, the ears, the nerves. So for you to simplify, I have drawn a diagram on the board and I am going to explain you in short about the balancing system. So as you can see, this is the right ear, this is the left ear, this is something called as the small brain, which consists of the brainstem and the cerebellum. So the balancing system is comprised of the vestibular system in the ear, and this vestibular system is connected to the brainstem and the cerebellum. So the problem can arise either from the brain, that is the brainstem or the cerebellum, or it can arise from the ears. So as you very well know, the right ear has 3 tubes, those are called as the semicircular canals which have fluid. The left ear has 3 tubes called as the semicircular canals which again contain fluid, and the signals from these vestibular system is carried by this red colored nerve, that is the vestibular nerve, and which connects into the brainstem and the cerebellum. So though the system seems complex, it is the job of the doctor to differentiate whether the vertigo is arising from the ear, whether the vertigo is arising from the brain, it's arising from the balancing system. There are many medical conditions which can be confused with vertigo. So I am going to tell you in brief about these medical conditions which cause vertigo. Also, the aim of the doctor is to differentiate whether it's a serious underlying disease or it is some benign, benign disease that is causing the vertigo. Because if it's a serious disease, the patient may need investigations, the patient may need admission, and he or she may need urgent treatment and admission. So, what are the common medical conditions that can be confused with vertigo or dizziness? The common medical conditions in my clinical practice that I have seen are problems with hemoglobin. If a patient has very low hemoglobin, that is anemia, they can have vague kind of symptoms, vague kind of weakness, they can feel dizzy all the time. So, anemia can give rise to dizziness. Then the other extreme of hemoglobin is very high hemoglobin. Some people have something called as polycythemia, wherein they have hemoglobins above 17, above 18 grams, and these can also come with symptoms of dizziness. So, first medical condition is regarding the hemoglobin. The second medical condition that can commonly cause dizziness is basically low sugars, especially in diabetic people. Diabetic people who are experiencing symptoms of low sugar, that is hypoglycemia, they can have sweating, they can have tremors, they can have generalized weakness, and they can also complain of vague dizziness. So, what are the things you can do at home? If you have a BP apparatus at home, check your blood pressure. If you have a sugar machine at home, check your sugars. Very low BP can also sometimes cause dizziness, and that is called as postural hypotension. Many of these patients are on many antihypertensives, and what happens is when they get up from the lying down position, the BP may fall down, and that is why temporarily the blood supply to the brain may go down and patients can experience dizziness. So, hemoglobin issues, BP issues, sugar issues, they can cause dizziness. Then the other common condition, medical condition that can cause dizziness is basically cardiac conditions. People having a weak heart, wherein the heart is pumping low, or if there is a valvular issue, these people can experience dizziness. Sometimes people having rhythm disturbances of the heart, like arrhythmias, wherein the pulse rate goes very low or the pulse rate goes very high, that can also be confused with dizziness. So, the doctor first looks at these common clinical conditions which can present as dizziness, basically hemoglobin issues, blood pressure issues, sugar issues, and cardiac issues. And then we move on to the problem with the balancing system. As I told you, the balancing system is in the ear and the balancing system is also in the brain. So, the doctor performs various bedside clinical tests to differentiate whether this vertigo is arising from the ear or it is arising from the balancing system. And once he makes a clinical impression, then he may order a few tests. The tests may include an ENT consultation, hearing testing, some blood tests, and it may also include imaging of the brain. So, after having done that, he decides how to treat. Now, as a neurologist, I am going to talk in brief about what are the common conditions presenting to my OPD in the neurology clinic in my daily practice. So, the commonest conditions that I see in my clinical practice, the commonest I would say is BPPV, that is benign paroxysmal positional vertigo. This is the commonest cause of vertigo, be it any outdoor patient, the commonest cause is usually positional vertigo. So, what are the symptoms in BPPV? BPPV, as the name suggests, it is benign, which means first of all you shouldn't panic. It's a benign disease, it's not a life threatening disease, it's going to be benign. Paroxysmal, which means it comes and it goes off, it comes and it goes off. And positional, what does it mean by positional? Meaning the symptoms appear only when the head is in a particular position. For example, most of my patients complain that when they are getting up from the lying down position in the bed, they complain of vertigo, that is spinning sensation. Or if when they are in the bed, they are turning the head to the right in their sleep, or they are turning to the head to their left, they start experiencing vertigo. That is again positional vertigo. And the last complaint that they say is when they bend down or when they look up, they also experience vertigo. So, all these come down under are categorized under positional vertigo. And this being the commonest entity, I think all the medical fraternity should be very aware, and they should send them to appropriate specialists, that is either the ENT consultants or the neurologists. Both of them can treat this very treatable entity. It's not life threatening and it is very treatable. So, what happens is, let us see at the diagram now again. So as you all know, as I've told you, this is the right ear, this is the left ear, and these are the three tubes. Normally in every individual there are something called as otoconia in the inner ear. These are calcium crystals and these are normally stuck in one position. But what happens is, because of head trauma or because of some other disease, what happens is these crystals, they deviate or they slip off from the original position into either of these tubes, the commonest being the posterior canal and the horizontal canal. And as I told you, these tubes contain something called as endolymph, that is water. And so what happens when the patient lies down or he gets up, these calcium crystals also start rotating inside those tubes, and that is what gives rise to the sensation of vertigo. So what we are going to do when you come to our OPDs, to our clinics, is that we are trying to get back these crystals from those tubes back to their original position. So that is where, you know, testing is very important. We make the patient lie down on the right side, we make the patient lie down on the left side, and we start examining as to which position the vertigo is appearing. And depending on that, we give something called as maneuvering, wherein we give different neck positions, different head positions, and we bring back the crystals to their original position. So this is something for patients with benign positional vertigo, and it is very treatable. Sadly, many patients are unaware of this clinical condition, and I have seen patients coming to my clinic roaming around everywhere without a diagnosis and just popping all vertigo medicines like Vertins, Tugeron, Stemetil, and n number of medicines, and they never get complete relief. So this is a clinical condition which is missed, which should be diagnosed in time, and it is very treatable, and there are no medicines needed. It is just the therapeutic maneuvering that is needed for these kind of diseases. Now the second common condition so for this BPPV, what I do is I do not write many drugs. I give them positioning, and then I ask them to avoid sleeping during the daytime, and I advise them some exercises at home. Now the second common clinical condition presenting to neurologists is migrainous vertigo. So I think you all must be very well aware about what is migraine. Migraine is one kind of a headache which is due to a chemical imbalance in the brain. So migraine sometimes, instead of presenting as headache, instead of coming out as headache, it sometimes comes out as vertigo, that is spinning sensation. So usually these patients need something called as lifestyle interventions, wherein they have to identify the triggers. Is there sleep deprivation that is causing the problem? Is there delay of food intake or lack of food intake that is causing the problem? Or what are the other issues? Is he using the cell phone excessively? Is the screen time in excess? So all these triggers need to be addressed, and obviously we start them on something called as prophylaxis in order to prevent such further attacks. So these were the common non-life threatening clinical conditions presenting as vertigo. Now you should also be aware that sometimes vertigo can be caused because of a serious underlying brain disease. And what is that brain disease that can cause vertigo? It's a brain stroke. So as you all very well know, brain stroke usually presents as paralysis of one side of the body, either one side of the face, one side of the tongue, one-sided arm, or one-sided leg paralysis. But there are some brain strokes called as posterior circulation strokes, which affect the small brain, that is the balancing system. They can present to you with balancing issues, which means that the patient is unable to balance properly. He will walk as if he is, drunken alcohol, and he may have lot of vertiginous sensation also. So as a neurologist, my role is to differentiate between serious brain stroke versus these non-serious, non-life threatening BPPVs and migrainous vertigo. So obviously we have some bedside clinical tests wherein we can differentiate whether this is a serious brain stroke or it's some non-serious disease. And obviously if needed, the neurologist is going to order a brain scan, preferably an MRI scan, and then is going to advise you further treatment. So finally, I would like to end my talk by summarizing all the things that I have told you. So vertigo is not a disease, it's a symptom. It can happen because of many clinical medical conditions like low hemoglobin, high hemoglobin, low blood pressure, low blood sugars, any cardiac disease also. Whereas it can also arise from diseases of the ear or diseases of the small brain, that is the balancing system. So do not neglect your symptoms. go to the concerned specialist, whether it be the neurologist, the ENT specialist or the general physician, so that they can diagnose your disease in time and give you appropriate treatment. But remember this condition called as positional vertigo, which I am nowadays seeing in the post-COVID era. This is because many people, because they have not much to do, they are sleeping in the daytime. So with this I end my talk regarding vertigo awareness, and I suggest all of you not to neglect your symptoms and consult your concerned doctor within time. Thank you.